National Assembly has passed the Special Appropriations Bill allocating additional funding to the Health Department. The department requested the funds following the withdrawal of PEPFAR support by the United States to South Africa and other countries last year. The bill provides an additional $754 million to the National Department of Health in response to a R4 billion funding shortfall caused by these cuts. Get you some reaction now. We're joined by SAMATU Deputy President, Dr. Tshilidzi Sadiki. It's great to have you on. Thanks very much indeed. This is going to be a lifeline, I imagine, particularly for those sectors that depended on PEPFAR for HIV and AIDS funding.
Good morning, Michelle, and good morning to your viewers. Indeed, the South African Medical Association Trade Union is pleased by the passing of the Special Appropriation Bill for Health, which, as you correctly indicated, has allocated additional funding to the health budget, particularly to address the funding deficit that would have been created by the withdrawal of the donor funds that were funding particularly programs related to HIV, AIDS, and TB care in South Africa. So we really welcome this bill.
Yeah. The Finance Minister as well, Dr. Sadiki, made some comments about how this relates to the importance of speeding up the National Health Insurance Fund, NHI. Enoch Godongwana is saying that there is a need for self-sufficiency and a need to move with speed to address access to healthcare through the implementation of NHI. Would you agree with that statement?
Thank you for that. As the South African Medical Association Trade Union, we have been categorically clear in as far as what we believe it's important that we implement the National Health Insurance Act. And the reason for our support for the National Health Insurance Act has always been the fact that we would love to see South Africa move speedily towards universal health coverage, where every citizen, irrespective of the socio-economic status, receive the necessary healthcare services that they deserve, which is that is protected in the Constitution of the Republic. We also agree. We also want to agree and reiterate the fact that indeed we must be a self-sufficient republic, especially when it comes to essential services such as the provision of healthcare services. That never again should we find ourselves in situations where we have to rely on donor funding for the provision of healthcare services. That we agree with.
There are still several questions, though, aren't there, Dr. Sadiki, about where the money for NHI will come from. Also, critics of NHI will say there actually is enough in the health department's budget to ensure that there is equitable healthcare for everyone, but so much of that money is lost to corruption.
Yes, indeed. Those questions will remain in the public. There are different critics, a whole lot of questions, uncertainties that have been raised. But what we really need to focus our energy on is the fact that all of us, whether those that are for NHI and those that are against the NHI, agree across board that we need universal health coverage. We need health reform in South Africa. And the NHI has been identified as a vehicle that will lead us to that realization. On the question where the funds will come from, we also want to reiterate that we are of the opinion that South Africa does not have, or the South African healthcare system does not have a problem of funding. It has got a problem of how we use the funding. And perhaps the first place where we should start should be to deal with the leaks that exist within the funding models in South Africa, particularly when it comes to the misuse of the funds and the corruption that is rampant within the healthcare system.
Yeah.
So we need to really move swiftly towards the realization of universal health coverage for all.
Yeah. So you agree then with critics of NHI that we do have enough in our national health budget to ensure equitable healthcare for everyone in the country, and that we should put perhaps a pause on NHI. It does seem like there will be a pause anyway because there is court action that is fighting the implementation of NHI.
You are correct. I think what we should be doing, both as the supporters of NHI, as users of the public healthcare system, as unions, as parties or organizations that are opposing the NHI, and as government, is that we should try and find each other and rally behind what we all believe in. We all agree, whether for or against the NHI, we all agree, even the parties that are in court, they all agree that there is a need for reform within the public healthcare system and health in general in this country. And we also agreed that universal health coverage is something that we need to really work towards implementation. And we also agreed that the funding model needs to change. Therefore, if we agree on those fundamental issues, I do not see why we should only communicate or express our views through the courts of law. I think there is still enough room for meaningful dialogue and conversation so that we find each other and move swiftly towards ensuring that the patients, the population of this country that is in dire need of healthcare services, particularly those that cannot afford private healthcare services, then get the access and the quality healthcare services that they deserve.
The withdrawal of PEPFAR funding by the US was a very bleak reminder, and I think one of the political parties made this statement in the wake of Donald Trump's decision around PEPFAR, that we shouldn't be depending as South Africa on donor funding to ensure that our fight against HIV doesn't take any steps back when we have made so much progress.
Yes, you will recall that as South Africa, we actually have done a great job in as far as providing healthcare services for people that are affected and living with the triple disease, HIV, AIDS, and tuberculosis. And it is important that we acknowledge that when it comes to the provisions of such essential services and the implementation of such important programs, we should never again find ourselves in a situation where we rely on donor funding for the provision of such services and programs. And it is important that moving forward into the future, we factor in all these important programs, particularly those that relates to the provision of health at large, so that we are able to provide funding and budgeting for it rather than relying on donor funds.
Certainly. Dr. Tshilidzi Sadiki is the Deputy President of the South African Medical Association Trade Union. Dr. Sadiki, thanks very much for your time this Wednesday. Well, plenty more still ahead for you.